Do you have weak bones? Let's work out what your bone density scan results mean. Hi, I'm Dr. Knight. I am a geriatric and general medicine registrar, and welcome to Getting On, the series where we try and stop worrying about getting older and just start getting on. This is our bone health series where we try and focus on how we can make our bones nice and strong to try and prevent fractures in the future. Now, I've done quite a few videos already, which you might want to watch before this one, which previously explain why we worry about bone health, what a DEXA or bone density scan is, and this video itself is focusing actually on what your bone density scan results actually mean. So I would encourage you to watch the other videos first, else this one might not make much sense. So you've had your bone density scan and now you're waiting for your results. How long will you be waiting? What do the results mean? And what do we do next? Just as a quick reminder about why we care about our bone density so much and why we care about our bone health so much. We really need strong, dense bones in order to carry us and in order to resist breaking. As we get older, we just naturally get thinner bones, unfortunately, and there are lots of other risk factors that can contribute towards us getting thinner bones too. Now, thin bones in and of themselves aren't dangerous, but the thing that is dangerous is something called a fragility fracture. And if you have weaker bones, you are at an increased risk of having a fragility fracture. A fragility fracture is basically a fracture that happens kind of with a low impact trauma, like just falling off this chair or falling from a standing height. Now, fragility fractures can have quite a few long-standing consequences, so it is really important that we try to avoid them. Today, like always, I'm using some really good resources that I encourage you to go and look at yourself, and they include the Royal Osteoporosis Society, the NICE guidelines, so the National Institute for Clinical Excellence, the NOG guidelines, which is the National Osteoporosis Guideline Group, and also the good old classic NHS website. You've been for your scan, now what? Well, the scan itself, the report normally takes about 3 weeks to be generated, and you should be able to get the results via either email or text or by a phone call from whoever ordered the scan. Now, bear in mind that each place is different depending on where you are in the country or whether you've got the scan via your GP or via the hospital, but don't suffer in silence. If you're waiting for a really long time, make sure you pick up the phone and get in contact with the person who ordered the scan because they should be going through the results with you. Now, let's discuss the results themselves. You might get a full copy of the report depending on where you got your scan that might look a little bit like this, which looks a little bit intimidating. You might not get sent the imaged report exactly like this. You might just be told the outcome by your doctor or healthcare professional. But let's talk about the numbers and, in fact, more importantly, the letters. So the main letter that we care about is a score called the T-score. Now, the T-score is something that compares your bone with the bones of the sort of healthiest, normal, younger adult that you can imagine. So it says, this is your bone and this is a normal, healthy bone, and it tells you the difference between those. So a T-score of 1 to -1 means that you have normal bone. So this means that you have perfectly normal, healthy bone with a good bone mass density. A T-score of -1 to -2.5 means that you have low bone density. Now, this is called osteopenia, and that just means thinning of the bones. It is really common in older adults, and it means that your bones are a little bit weaker than average. And then finally, a T-score of -2.5 or below means that you have osteoporosis. This means that your bone density really is much lower and you are at a much increased risk of having a fragility fracture, which is the thing that we're trying to avoid. Another letter score that you might see on your letter or report when you get it is something called a Z-score. A Z-score compares your bone to the bones of the average person your age. Now, you don't really have to worry about Z-scores too much. We mainly use these in younger adults when we're worried about their bone density in other conditions such as brittle bone disease. So we don't really worry about Z-scores too much when it comes to older adults' bone health and osteoporosis. It doesn't really mean that much to us. What do we do with these number scores? Essentially, the lower your score, the more likely you are to benefit from osteoporosis treatment. Let's just talk through that a little bit. So if you have a normal score, which is from +1 to -1, you're all good. Your bones are nice and healthy. That doesn't mean you can just slack off. It means you've done something pretty good to get to this stage of having normal bones. Congratulations. But you need to keep it up. Whatever you're doing, keep it up, or bear in mind that you could still have reducing bone density as you get older. So putting into place some lifestyle modifications now will mean that your bones will stay normal and healthy, and that is the aim. And then if you're all the way on the other end of the spectrum and your score is really low, so it's -2.5 or lower, you are in that osteoporosis category, and you will likely benefit from drug treatments and medications to help strengthen your bones. So it's very likely that your healthcare professional will offer you something called bisphosphonates. Now, I won't go into what bisphosphonates are in this video, but I will do another video that explains in detail what bisphosphonates are. And then in that middle category, we have this slightly grey area. So if your T-score is between -1 and -2.5, you're in that grey area called osteopenia, where you have slightly thinner bones than average, so the normal bones do, but you're not quite in that osteoporosis category. So do you need treatment at this stage? Well, usually we can just consider lifestyle factors, and your doctor will discuss with you things like stopping smoking, reducing alcohol intake, maybe adjusting other medications in order to reduce your risk of having a fracture. However, it's really important to look at the bigger picture, and we don't just look at your bone density scan in order to make a decision about treatment. We look at your overall risk using a risk stratification tool called the FRAX score. So essentially, your doctor will put your bone density score from this DEXA scan into a calculator tool called the FRAX score, along with other risk factors such as whether you've had a previous fracture, whether you've had a parent who's had a fracture before, whether you're a smoker, whether you drink alcohol, lots of other factors, your weight, your height, and that will give us a score as to whether you are at a really high risk of having a fracture or not. And if you're in the very high risk category, you might also be recommended to be started on treatment. Remember, although bone mineral density told to us from your DEXA scan is a really good indicator of how strong your bones are, it's not really an exact prediction as to whether you will get a fracture or not. For example, someone with a low bone mineral density might never have a fracture, and then you might have someone with a higher bone mineral density who has lots of fractures. And that's because of all of these other factors that we've discussed, like your age and your sex and your weight, that all contribute together to how your bone health is and your likelihood of having a fracture. Will you need another DEXA scan? Well, it's quite likely you might need a repeat DEXA scan or bone mineral density scan in the future, and that can be for a few different reasons. It can be either that you've been started on treatment and your doctor wants to assess whether the treatment has worked or whether your bone mineral density isn't getting any better on treatment. It might be that you're in that intermediate risk category, so you've got osteopenia, you've got thinner bones, and your doctor in a few years' time might want to think about whether your bones have gotten worse over time to push you into that treatment category. Repeat scans are usually done 3 to 5 years after your first scan, so don't worry if you don't get offered a scan within the year of having your last scan. That's because changes in our bones happen really slowly over years and years, so there's really no point in doing one as soon as you've just done your first one. You really have to give it some time before you recheck your bone mineral density. To summarise, a bone density scan gives us some really good information about your bone mineral density, but it's important to take that as part of a much bigger picture of our overall bone health. If your T-score is less than -2.5, then you have osteoporosis, and it's very likely that your doctor will recommend that you're started on medication for your bone health. This medication is called a bisphosphonate. If your T-score is anything above -2.5, then your doctor will consider your FRAX score and consider your overall risk of having a fracture before considering starting treatment. And it's important to remember that even if you are started on treatment or if you're not started on treatment, lifestyle modification and lifestyle factors play a really huge part in your bone health, and they really need to be looked into. So making sure that you're eating the right thing, that you're moving in the right way, and that you're not smoking and reducing alcohol intake, all of these things make up good bone health, and you have to do the two together. You have to do the medications and you have to do lifestyle factors in order to make your bones nice and strong. So if you've had a DEXA scan, hopefully this video has been insightful as to how you can interpret your results. I would say if you get DEXA scan results in the post or by phone or by email, just don't panic. Your healthcare professional should talk through the results with you and what the results mean. And if you haven't heard from them, I'd advise that you make an appointment to discuss your results with them. Thank you for watching. I do encourage you to watch the other videos in this bone health series if you want to learn more about how to keep your bones nice, healthy and strong to reduce your risk of fragility fractures in the future. See you next time.